Hi, and welcome back to the Mom and Mind podcast. I am your host, Dr. Kat, and this is another episode of Behind the Sessions. What I want to talk about today is postpartum depression. In my private practice, I meet with moms primarily who are going through the reproductive journey, anywhere from trying to be pregnant, going through infertility treatments, becoming pregnant, experiencing loss, going through birth, in the early postpartum. And one thing that is consistently true is that perinatal mental health conditions kind of sneak up on people. They don't quite know what's going on. They don't quite know how to recognize the signs or the symptoms or how to differentiate between just kind of like new mom stuff, being tired, and when to actually, be concerned about something like a perinatal mental health condition. And one of those conditions is postpartum depression. Now, I want to say that perinatal depression can happen anytime in the reproductive journey. And if somebody's experiencing depression during pregnancy, they are more likely to continue to experience depression in postpartum, or for it to even worsen if they're not getting help during pregnancy to help manage that depression, whether it be by therapy or medication or both. It is really, really important to be able to recognize and notice when you're experiencing signs or symptoms of any perinatal mental health condition. But today I'm going to focus on depression. Now I'm going to focus primarily on postpartum. And what is really hard for people to notice is if they're experiencing what we call the baby blues versus a postpartum depression. Now, the baby blues are very common, and 80% or so of people will experience the baby blues. And that is a pretty normal transition into parenting and parenthood after having a baby. This is like having some ups and downs in the first 2 weeks. Your symptoms could be like tearfulness or having some low grade mood swings, ups and downs, really. You could obviously be really tired because you've just had a baby, which the tiredness makes it hard to recognize what's going on. But you could, what I liken it to is like kind of a low grade PMS, where you could have some tearfulness, but you can generally hold on to your mood. You're generally okay. Like your home base is that you're okay, even though you might be having some mood changes and that tearfulness. But if you have good support, if you're able to get some rest, you have decent nutrition, you have some supportive things to help you along, for most people that goes away. Those baby blues transition, and you're able to kind of feel a little bit more like yourself, even though you might still be in the fog of not having a lot of sleep and absolutely still in the transition to being a new parent and learning and all of the things that go on with that. But if your symptoms are lasting longer than 2 weeks, or during those 2 weeks, your symptoms are more intense, it's not like just a mood that comes and goes, but it's pretty consistently feeling down, feeling sad, feeling tearful, feeling hopeless, feeling numb, and I'll go into some other symptoms in a minute. You could be looking at something like postpartum depression. We're looking, and especially in those first couple of weeks, we're looking at symptom intensity and duration of symptoms. So that is if we're just looking at that first, couple of weeks to a month in the postpartum period. But it is important to note that postpartum depression can come on anytime within the first year postpartum. And there are a number of reasons for that. One is situational changes, like returning to work or not having help around anymore, other people returning to work, or family members going, or stopping nursing, or restarting your period, or any number of other stressors that can increase the stress load on you, can impact the development of a perinatal mood or anxiety disorder. So, if we take a closer look at the symptoms you might be having, two of the main symptoms of depression are the feelings of being down, depressed, or sad, and anhedonia, which is feeling like not you don't want to do things anymore or like you used to do them. Like you just feel blah, you don't want to do things. You could also be experiencing changes in your eating patterns, eating more, eating less, changes in your sleeping patterns, sleeping more, sleeping less. And these two things are really difficult to differentiate from just, some of the common shifts and changes that happen in postpartum because there are changes in eating and there are changes in sleep patterns. So, this one you might have to take a closer look or monitor a little bit more frequently or just take note of to see if these patterns, eating and sleeping patterns, are well outside of your norm. Which they again might be anyways because it's a huge transition into parenthood, or if it's becoming concerning for you, or something that feels like unmanageable. Other symptoms include feeling agitated, physically agitated. You could experiencing also like a heaviness or a slowing of your body, just kind of feeling like you're walking through molasses. Low energy, fatigue. There's or some really physical symptoms that you can be having. Again, hard to differentiate if you're very tired as well. So taking a closer look at that, just taking note of it, tracking it if you can, day to day can help you differentiate or understand if you're feeling symptoms of depression. Other symptoms of depression are difficulty concentrating, kind of memory, fogginess. And again, with lack of sleep, those things can be true as well. So one way to know, is it like lack of sleep or is it depression or anything else, is how do you feel? If you're able to get a couple of nights of solid sleep with the help of others, do you feel better? Is there an improvement in how you're feeling? Or is it like a slight improvement, but you generally feel the same? Then we could, again, be looking at something like depression. Now, those are symptoms of postpartum depression. But a couple of things I want to highlight is one, general depression, or let's just say depression when you are not pregnant or postpartum, is different. The symptoms are the same. And if you look in the DSM, which is the Diagnostic and Statistical Manual for mental health conditions, we're looking at the same symptom sets. However, the context is different. What makes any perinatal mental health condition harder than, I would say, if it's sort of quote unquote just you dealing with something, is that you are now dealing with depression in the context of also having a child. And that makes a huge difference because, one, the sleep deprivation, as I've already mentioned in the first 5 minutes, is huge. Manages to shift everything. You're not just sleep deprived on your own, you're also sleep deprived and still need to take care of a human. And that human child is dependent on you and the other caregivers who are responsible for feeding and changing and bathing and all of that stuff. Second, you're experiencing hormonal changes that you wouldn't be experiencing at other times. Yes, if you have depression and you also have PMS or PMDD, then for sure you are experiencing hormonal changes that shift your mood. However, again, context is now there's a baby around. The hormonal shifts you are experiencing, it's not like you can just go and take care of yourself or go sleep, go whatever. You have to be in consideration also of your child's needs. If you are home and you're the only caregiver, or even if you are managing caregiving with somebody else, there's still a negotiation. There's still okay, who's going to do what? there's several steps that you have to go through before you can just take care of yourself. And so all of that includes physical demands. You are changing, feeding, bathing, all of the duties that come along with caregiving are happening while you don't feel well. And that really, really makes things so much harder. You are also in the context of a relationship with your baby. So, in this context of being in a relationship with your baby, is where I hear the most of what it feels like to be depressed. This is when I hear, I'm not a good mom. I'm a failure. I'm a bad mom. I am bad. I don't feel connected to my baby. Somebody else would do a better job. Um, I feel alone in this process. I feel like I don't know what I'm doing. And while certainly somebody could feel like they didn't know what they were doing or this was really, really hard and not have depression, when you're also dealing with depression, your thought processes are naturally much more judgmental, self critical, um, hopeless, helpless. That internal dialogue is just so negative. But when you add in the context of being in relationship to this new human, your baby, it makes it that much harder because it's not just you feeling like, let's say, a failure, but you feel like a failure in relation to your baby. You feel like you are failing your child. And those depression feelings are so much heavier because it's multiplied. Again, it's not just like a common depression feeling is feeling really bad about yourself. But when you feel bad about yourself and you're still responsible to be taking care of your baby, it just feels exponentially worse. And what is so sneaky about all of these feelings is that we are kind of so consumed by them that it's not registering always that, oh, maybe this means I'm going through something. Maybe this means I'm dealing with depression. Most of what it feels like is that you are just bad, or the bad mom, the bad caregiver, that you don't know what you're doing. It's it's more than just I feel bad, it's that I am bad. That's what depression does to your thinking process. And you don't always aren't always able to pull in the context of like, okay, well, I just had a baby. I have had a history of depression, or, there are really massive stressors in my life that are contributing to how I might be feeling right now. It doesn't um, lend itself, depression doesn't lend itself to be able to remember the context. That's why it is so important. All of the contextual factors that I was just going through, the reasons why depression after having a baby is that much harder. Remembering that context is important. I'm pointing it out so that if this is something that you're dealing with, it can, raise a little flag for you for something to think about. And I'll get to that in just a moment of what we can do. And it's also really important to remember that depression is relatively common, meaning that about 20% of people will experience a postpartum depression. And that's a lot. That's a lot of people. That's why we need to be paying attention to it, because it is that important to make sure that people are getting the help that they need. Another reason why it's so important is because with the more severe symptoms of depression, you can have escape fantasies, like not wanting to be here anymore, thoughts of suicide. And that is really scary. That is scary because death by suicide in the postpartum period is the second leading cause of death postpartum. That's terrifying for me. That's terrifying for all of us who are supporting moms through this period of time. And it's why we need to be able to recognize what's happening as early as possible and get people the help that they need as soon as possible. And when people are that depressed, it can also be really difficult to feel connected and bond to baby. And there are a lot of reasons for that, but I think it is most important just to recognize that that is something that people can feel. And if that is part of your experience, then it is an indicator that you're going through something. It's not an indicator that you are a bad parent. It's not an indicator that you are failing. These are all the symptoms that I'm telling you are so that you can recognize that something's actually happening. It's not you, it's what you're going through. You are not a bad mom or bad parent or any of those things. It is that you are suffering and you need help. That's it. It doesn't need to be deeper than that. We don't need to go into some existential, like, why did I become a parent? Although certainly people have those thoughts because it's a big change. What I'm saying is that you are going through something and there is help for it, and we need to get you that help as soon as possible. Postpartum depression and all perinatal mental health conditions are medical conditions. Just like all other physical conditions, mental health conditions are physical. Physical is mental, mental is physical. It is not an indicator of your ability to parent or an indicator of the quality of your parenting. It just simply means that you need more help, and we need to get you to that help and support as soon as possible. And I'd like to say a couple of things about stigma. There are a lot of reasons that, one, people don't talk about what's going on for them, whether it's depression or anything like that, or even recognize that it's happening for them. And that is because of stigma. So if you're somebody who, like, you kind of know something's not quite right, you're concerned, or you feel some twinge of that within you, and then you shut it down because, one, you don't want to be feeling that way, and two, you don't want anybody else to know that you're feeling that way for fear of judgment or not knowing how they'll respond to you or what they'll think about you or anything along those lines. Just, I prefer to call that out and have that be known as a factor that might be silencing you. All your the stigma that's out there, plus also whatever other internalized stigma that you may have. And also, like, this just sucks. Nobody wants to feel this way. And to get to a point where you're suffering so much that you're forced to admit it to yourself is hard enough. So if you feel it creeping in, if you feel like, ugh, something doesn't feel quite right, I don't feel like how I usually feel, I don't feel like myself, I don't feel how I want to feel, then just take note of that. Kind of take stock of how things have shifted for you. And know that you don't have to white knuckle your way through this. There is help. There's good help out there. There's free support out there. And there's a whole network of people who are waiting, just waiting to be able to help you. So I'll come back to that in a moment. But I think it's really important to just call out this stigma, call out what we do to ourselves when we're not feeling well. It is just so easy to talk yourself out of whatever. That, oh, it's fine. If I just get sleep, I'll be fine. If I just make it till next week, it'll be fine. If I just. And if you're starting to have that negotiation with yourself, that's an indicator as well that something's going on, whether it's depression or not. I don't know. But these kinds of suppressing of our own feelings, making these compromises with ourselves, or trying to convince ourselves out of what's really going on, ends up being detrimental to us. We end up suffering for longer than we need to. And it's in this day and age, there are resources. We are past the point, I believe strongly, we are past the point of saying nobody talks about this. Because we do. I do. There are a lot of other people who do talk about this. And we're more and more trying to talk about perinatal mental health conditions, postpartum depression, because it's needed for all of the reasons I've already talked about just in this last however many minutes. It is necessary that we continue to talk about it and be louder about it. It's really not anymore that nobody's talking about it. It's that it needs to be talked about all the time, in every place, everywhere, by every professional. What I also know to be true is that people get better if you have the right help, the right support, the right tools. And it doesn't have to be perfect. It doesn't have to look perfect, whatever those supports end up being. But some support is better than none, and people do get better. I know this because I see it every day. I see people get the support they need, come into therapy, do the hard work. It is hard initially to come into therapy and to talk about things that you don't want to talk about and that you'd rather ignore, that you'd like to pretend are not happening and don't exist. I know where that path leads. That path leads to more suffering. The not talking about it, the pretending that it doesn't exist. I know it leads to more suffering because I did that. So I'm speaking from experience personally as well. And from the thousands of women that I've supported to get to out of suffering and into healing, I have yet to hear somebody say, I wish I had waited longer to get help. Nobody's saying that. Anybody who's put off their healing for long enough will tell you that they wish they had gotten help sooner, that they wouldn't have had to suffer for so long, that they could have gotten back to their quality of life sooner. And there's a lot of space and a lot of room for healing. And yes, it is hard. It can be hard, but that doesn't mean you shouldn't do it. And that is not another reason to avoid starting the process. It's just the most worthwhile journey. One thing that you can start doing right away is to test the waters with somebody that knows you well, that you know has a good listening ear, to tell them that you're not feeling well or not feeling like yourself, or that you think something might be going on for you. If you have somebody in your life who is supportive and who can listen and be sympathetic, if not empathetic, then great. That's a good place to start. We all need those people who will, love us, care about us, no matter what we're going through. And hopefully you have somebody like that in your life. If you're not sure if people around you will be supportive, there are avenues to find support. There are free resources through Postpartum Support International. That's postpartum.net. They have a helpline. That number is a phone line and a text line. It's 1-800-944-4773. That's a call line and a text line. Somebody will reach back out to you to get you started on the path to getting the right resources. That website also has a therapist directory, so you can look for therapists in your area. It also has a ton of free online support groups that are continuously running. You can find something that meets your needs there. There is also a national maternal mental health hotline that is free and confidential, and that number is 1-833-TLC-MAMA. And you can call that number 24/7 and somebody will help you get to the resources you need to get to and make sure you get to them. And there are a ton of therapists out there who are trained in perinatal mental health, if not also perinatal mental health certified, who are ready, willing, waiting to help, because we know that you can get better. Even if you don't know that yet, we hold the hope for you and are happy to do that and are ecstatic along with you once you get out of this hole and start feeling like yourself again. It's one of my favorite parts of the work that I do is seeing somebody go from, suffering into healing and then getting to be in their life the way they want to be in their life. It's totally possible. And while you're looking into those resources or waiting to get to those resources, please, if you can muster it, just have some compassion for yourself as you're going through this. As I said before, and I say all of the time, you are not a bad mother. You are not a bad person. The things you are going through, it's a medical condition. It is a condition of not having enough support, not having a societal structure in place to give you what you need in order to be aware even of what's going on for you, let alone the support to prevent this from happening or the support to get through it the way you need to get through it. It's not you, it is what you're going through. And that is really important to remember. So please, please reach out for help, get the support that you need, and know that, so many of us have been through this. It's not an indicator of the type of person you are or the type of parent you are. And I know that you can feel better and get better. So I thank you so much for joining me today. If you know of anybody that this could be beneficial for, please pass this along. If it's a family member or a friend, or even if it's a care provider who, could use some of this information, please pass this along so that we can continue being vocal about this and continue educating and building into the awareness that this has to be on our radar. It can be treated and people can feel better. Thank you so much for being with me. Until next time.